the other thing I want to just throw out there, right? Nicole just put this in. Yeah, doulas are totally amazing and are doing great. They are awesome, and they are really helping a lot of women virtually, because they're wonderful support. They're a wonderful support in person, of course, but also virtually in this scenario, they've been doing an amazing job. So I think enlisting the help of a doula is a insanely effective, great idea. So do that if you can. Oh, there she is. Yes,
I'm back.
Awesome. Yay.
Sorry, I was listening to you from my phone.
Good.
And I worked really hard to get back online. I'm actually now online from my laptop because my desktop spazzed out. So I heard you. Thank you so much. You've been saying great things. Continue on doulas because you're doing an amazing job, Doc.
Oh, thanks. I was going. Well, I was just saying that, doulas are a great option for support, right? Because in truth, a partner is, your partner is there with you, but your partner is also having a baby. So the partner is going to be anxious as well. So a doula is a great option because the doula has done this before. The doula is there as a supportive comfort and can help you in times where your partner may not actually be as great. I always say, and I've said this to my husband, so I can say it now, his voice when I was delivering my children was actually like nails on a chalkboard. And I think having a doula would have been a great idea.
Yes.
Now, every woman's experience is different, but a doula can be a wonderful source of support. Other things women can do, look, it's your delivery, and things like if you like a candle scent, bring a candle, bring music that you want to listen to, have whatever things that you want in terms of having the room set up in a way that you want. The nurses are very aware of what's going on, and they're going to help you make this experience as comfortable as it can be, given the situation. And everyone's aware of what's going on, right? Yeah. No one is unaware.
And one candle idea that I love, because I know as someone who's done deliveries, the hospitals are very concerned about any naked lights. And so now they actually have these battery operated candles. So they're not real flames. They're not real flames, but it looks like a candle. It flickers in the same way. They don't emanate fragrance. Yes, because you don't want fire, particularly in most of the delivery rooms, you have an oxygen source. And so it's super cool, though, to set that ambiance and that mood. You can use now one of those battery-operated candles that achieves all of everything that you want out of it without the risk for the hospital or the birthing center. Yes. For those who don't know what a doula is, Doc, what is a doula? You've been talking about a doula, which there's a big move for doulas, particularly amongst women of color, because there's been a long concern about the disparity in maternal outcomes. And there's certainly now a big worry amongst some that COVID-19 would only broaden that disparity gap that women of color may get in the delivery room. And so there is a movement to get doulas for those patients as well, or to encourage it. Who is a doula exactly? Are they trained in any way? Who are doulas?
Doulas are trained. They have training. They are not obstetrically trained in terms that they are not going to deliver your baby, right? So they are not, they're not OBGYNs. They are not midwives. So they are not going to be the one sitting there actually delivering, but they are there as supports, and they're also there as liaisons. So they are really wonderful because sometimes women feel they don't have a voice.
Yes.
Or they feel like their voice can be somewhat overshadowed. Mm-hmm. And a doula is a great person to be there as your voice and your advocate and say, hey, you know what? I think, what we may want to do is X.
Yes.
And that, that's not necessarily in terms of medical advice, mm-hmm. but that may be in terms of, taking a moment to think about what the patient is actually experiencing, how she's feeling in that moment, when perhaps that's not being heard or seen.
Correct. And I think that's important for people to know, because I think amongst some healthcare professionals, doulas are seen as a problem. because perhaps there is a miscommunication about the role of a doula. But a trained doula, actually, in my experience, mind you, full disclosure, I have not delivered a baby since 2016. But in my experience, when I've worked with doulas, they've actually been a great help. And I've worked with doulas who understood their role, never overstepped bounds, and who had a shared interest in safe delivery, safe baby, safe mommy. And I think that's something that we have to communicate more, that it's not an adversarial relationship. And for you, the patient, it's not you're bringing a doula in so that they can fight your doctor. It's so that you work as a team. And if you're planning a doula, you really should discuss this with your OB before as well, so that they don't feel blindsided. Not that they should, but just to prepare the obstetrician, prepare the birthing team, whether it be your midwife, etc., that you will have this support with you.
And I mean, right now is an exceptional time. So right now is not the case, but this is this too shall pass. So
yes,
after social distancing and quarantining is over, I would just love to also say postpartum doulas are amazing.
What do they do?
Oh, they take care of mom. They help mom take care of baby, but they are so amazing for mom.
Yeah.
With a new baby, everyone often focuses on the baby.
Right.
Doulas come in and they're beautiful. They help mom. They can help mom with cooking. They can help mom in terms of learning how to take care of the baby, but they're really there to support mom in her journey as a new mom.
Yes.
And take care of her, because in truth, we don't mother moms well in this country.
It's true.
We really we forget that a new mother just had her life flipped upside down.
And inside out, literally.
Look, it's the most beautiful thing, right? And as a mom of 3, I look back at that time and it's like a big blur. But we, in so many other countries, there is an incredible focus on taking care of a new mother as well as taking care of a new baby.
Yes.
And it tends to be that those countries have lower levels of postpartum depression than in our country. And part of that is because we, day 2, day 3, we're like, sayonara,
Right. Send them home. You go home.
There's your baby.
We follow up in 6 weeks.
Right. And this, this 6-week postpartum visit, there's so many issues, right? And it's quick. And now at least there's a push to have like a 3-week check-in and what have you. But the point is, a postpartum doula really checks in on mom, checks in on the family, husband, partner, wife. Make sure everyone's doing okay.
Yes.
And that's an amazing thing, and can really help come in and, every patient I've had who has had a postpartum doula basically talks about this person as like a warmth, as a source of comfort and warmth, and a nurturer.
Yes. But it makes sense to me, because if we actually look back historically and culturally across cultures, across the world, there was that sort of person that was your helper once you were delivered, that helped you navigate the home, helped you navigate your path into parenthood, even if you've had children before. And so it looks like what we're looking now to do is marry or reintegrate some of those older cultural practices into our everyday perinatal care.
Absolutely, and we should. I mean,
yeah, it makes sense to me. Absolutely, it does.